The prostate is a gland in the male reproductive anatomy, and it has a number of different functions. First, it lets urine flow out of the body, and more importantly, it's there to nourish and protect sperm cells. Now, as men get older, prostate problems start to become more common, and they include an inflamed or an enlarged prostate, and in worst-case scenarios, prostate cancer, which is one of the most common but most treatable forms of cancer. This is Med Talk Health Talk on CNN Philippines, where your care comes first. I'm Dr. Freddy Gomez. Prostate problems are common, especially in older men. Now, to explain more about today's topic, let's welcome Dr. Romeo Lloyd Romero. He's a urologist and consultant at Casimiro A. Yenares Senior Memorial Hospital. We also have Dr. Evita Pagya-Bondok. She's a radiation oncologist and consultant at the National Kidney and Transplant Institute. Welcome to the show to both our doctors today. Now, the main function of the prostate is to secrete prostate fluid that helps transport sperm cells as well as protect it. Pero Dr. Rome, let's go back to basics muna and explain to our viewers what is the function ng prostate sa men.
Basically, secrete fluid that nourishes and protect the sperm. So this happens during ejaculation. So it mixes up with the sperm and then it becomes semen. So this is very important for the nourishment of the sperm.
As a person grows, the prostate may grow as well, and it can vary in sizes. But Dr. Rome, at what age should men start worrying about the growth of their prostate?
According to autopsy studies of men with enlarged prostate, they found out that at the age 30, the prostate starts to grow. And this is age-related, meaning as you age, your prostate enlarges more. So they also found out that when we get to 80 years old, 90% of us may have enlarged prostate. It would usually start at around 40, but in some studies, it would say around 55 years old.
Okay, and conditions affecting the prostate often cause some problems with urination or controlling the bladder. Dr. Rome, please walk us through some of these more common conditions that men with enlarging prostates may experience.
Okay, so that's another good question. So basically, if you have prostate problems such as enlarged prostate, prostatitis, or even prostate cancer, so you basically look for symptoms such as urinary frequency. Ito yung pag in a regular span of in a day, so you urinate frequently more than your usual. You can also have urgency. For example, you're traveling a long drive or you're watching a movie, then you have to make stops or you have to go out of the movie just to urinate. So that's urgency. There are also men who has nocturia. Nocturia is when you sleep, you wake up more than 2 times a night. This means your quality of life is that you're not having enough sleep. And there's also a feeling of incomplete emptying. And collectively, all that I said, these are called the lower urinary tract symptoms. And in some cases, some more worse cases, there's pain in urination. And there also can be blood in the urine.
Dr. Rome, explain natin sa ating mga viewers kung ano ba yung ibig sabihin ng BPH.
Okay, BPH is basically benign prostatic hyperplasia. So ang ibig sabihin lang nito, yung cells sa prostate natin ay dumadami. So this is due to growth factors and hormones such as androgens like testosterone and estrogen. So meron ding defect dito yung cell apoptosis or cell death.
Now, BPH may lead to prostate cancer or it may remain as just hypertrophic tissue for that matter. Pero Dr. Villa, so what could be factors that could lead someone's prostate into becoming cancerous?
So cancer is caused by changes in the cellular DNA. And when these changes become unregulated or unchecked, then the cells will multiply out of control. You can inherit these DNA changes from your parents. So that's what we call the family history. Or these changes can also develop during your lifetime because of the lifestyle that you have, like physical inactivity or your diet.
Ngayon, Dr. Rome, napag-usapan na natin some of the symptoms symptoms ng enlarged prostate kanina. But when it comes to prostate cancer, there are some symptoms, some red flags for that matter, that may want person to have themselves checked.
Okay, aside from what I mentioned earlier, those basically are a group of symptoms that may present for somebody who has prostate cancer. But it's also important to note that one with prostate cancer would also may present with bloody urine and difficulty in urination. And in addition, for metastatic diseases, one may present with bone pains or frequent fractures. So basically, it's a collection of what I said earlier, the lower urinary tract symptoms with other symptoms such as hematuria or blood in the urine. And also for the severe ones, they may have bone pains. But basically, it's more specific for the prostate and not for the cancer.
Okay, now the exact cause of prostate cancer is still unknown, but there are factors that make it more likely to develop. More on this when we come back. You're watching MedTalk Health Talk on CNN Philippines, where your connection to healthcare. The chances of successful treatment for prostate cancer increases when detected early, while it's still confined to the prostate. And the key here is early screening. This is MedTalk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez, and we want to help you understand the care you need and deserve. The standard for prostate cancer screening is the prostatic specific antigen, or the PSA test. I'd like our viewers to understand that this PSA screening test, or the screening for your prostate, should be done when there are no symptoms. So the PSA test, it's a blood test that measures the amount of PSA, which is a substance made by the prostate. Now, those who have prostate cancer may have higher levels of PSA in their blood. Dr. Villa, could you please explain to us what is the connection between itong prostatic specific antigen and that of prostate cancer?
Okay, so in prostate cancer, more PSA gets into the blood than is normal. However, it is to note that a high PSA blood level is not proof of cancer, and there are many other things that can cause a false positive test result, such as men with prostatitis or BPH. So that means to say that if a patient comes back with a PSA level that is high, his urologist will require him to undergo further testing to really confirm if there's a presence of prostate cancer.
Now, another test that will be done is a DRE, or a digital rectal exam, to feel for any abnormalities in the prostate. Dr. Rome, what type of information is important for the urologist here?
You just look for anything suspicious, basically, like if there's nodularities or irregularity, then the normal rubbery feel of the prostate. So for that, anything suspicious, it would already warrant us to do a biopsy or probably an MRI to look for the nodularities. And also, that's very important, no, because we always correlate the PSA with the DRE finding. So it doesn't mean that one is normal. We may already forgo with further treatment. So that's very important too. They correlate with each other and they go hand in hand. So we may request for both or do the DRE also.
Once someone starts their screening process, should they be screened every year? Anong interval nito, Dr. Rome?
So that's another good question. So basically, your PSA screening would depend on the initial result of your PSA. So the normal PSA, as of now, is less than 4. So for the first initial PSA, if it's less than 1, you may do the PSA screening every 2 to 4 years. And if your PSA is a bit higher, or 1 to 3, you may do PSA screening 1 to 2 years.
Okay. So now that the screening tests have been done, Dr. Villa, when is someone diagnosed to have prostate cancer? I think this is, of course, not the news we want to hear, but it's important to catch this as early as possible.
So the gold standard in any cancer diagnosis is always a tissue biopsy. For a suspected prostate cancer patient, like what Dr. Rome has mentioned a while ago, small tissue samples will be taken directly from several areas of the prostate, and then these tissues will be sent into the lab to be examined under a microscope by a pathologist. And if it is indeed cancer, then it will be given a Gleason score. And this score ranges from 2 to 10, and just mainly describes how likely it is a tumor will spread. So the lower the number, the less aggressive the tumor will be, and the less likely it will spread, and vice versa.
Now, treatment options for prostate cancer depend on several factors, such as how fast the cancer is spreading, or pretty much what stage or grade the cancer is discovered at. And prostate cancer that's detected early has a better chance for successful treatment. Dr. Villa, how do you determine what the best treatment option is?
So choosing the best treatment option for a patient with prostate cancer is generally based on the patient's age, the stage and the grade of his cancer, and the patient's general health condition, as well as the evaluation of the risk and benefit of each treatment option.
Now, Dr. Villa, we'll talk about surgery in a bit with Dr. Rome, but for now, when is radiotherapy needed for prostate cancer?
Okay, so there are two forms of radiotherapy that we actually do to a prostate cancer patient, and it depends on the stage and grade of the cancer, as well as, like what I mentioned, the age. So first, there's the brachytherapy. So the brachytherapy is wherein we place tiny radioactive seeds near the prostate, and these seeds stay in the prostate forever and gives a steady dose of radiation over a period of months, of a few months. So brachytherapy is given to a patient who has a longer life expectancy, that's usually a younger patient with a localized prostate cancer. Now, we also give it as a boost together with the external beam radiotherapy. So external beam radiotherapy is usually given for patients with either localized prostate cancer, locally advanced prostate cancer, recurrent prostate cancer, or even metastatic prostate cancer.
Okay, so now let's talk about surgery for the prostate, which includes removing part or maybe all of the prostate gland, and it's done to treat localized prostate cancer. Now, Dr. Rome, when naman is surgery the best option for a prostate pathology?
First of all, we assess the patient if he is capable of undergoing surgery. So we refer this patient for a medical risk assessment if the surgery would fit him. So basically what we try to do is to remove all the prostate. So the goal of the surgery is basically complete cancer control, grossly and microscopically. We also remove the lymph nodes if it's a higher stage, but we may forgo this on the low stage patient. If we cannot do the surgery, that is when we discuss other options, such as what Doc Villa said. And also in some cases, just for another form of cancer control, if we cannot do the surgery, we may opt to start on hormonal therapy for the patient, because it's important to note why these cancers are aggressive. It's because of the hormone. So hormonal therapy, we basically just stop the testosterone from converting into a possible source of the cancer.
You can reduce your risk for prostate cancer by keeping your prostate healthy. Your health is our mission. Stay with us. We're here to build a healthier future for you. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. There are many available treatment options for prostate gland enlargement, or BPH, but there are some things you can do on your own to lessen those symptoms. Dr. Rome, can you give some tips on how to relieve the symptoms of BPH?
Okay, so aside from going into medications, there are other things that you can do to relieve the symptoms. So basically, since this is an obstructive prostate or an enlarged prostate, so what you can do is to do lifestyle medications such as fluid management. For example, if you're used to drinking more than 1 glass of water every night, so you may opt to decrease that. In addition to the fluid management, if your symptoms are really severe, you can lessen your fluid intake to 2 liters per day. And also, there are drinks and foods that are known diuretics like caffeine, alcohol, and you may also would try to decrease eating of spicy foods and acidic foods. And also, as part of the lifestyle modifications in relation to what I said. So for example, you're traveling, it's a long drive. So what you can try to do is do some concentration exercises such as Kegel's exercises, or in some textbook, they would suggest mind exercises or distraction techniques for you to lessen those symptoms. And also for patients who has comorbid conditions such as hypertension, it's also nice to review their medications because this medication, some of their medications are known to be diuretics also. So they may talk to their doctor or their cardiologist to modify the medications due to their prostate problem. And if all these fails, they might do a consult with a urologist to check or ask for medications for the prostate.
Okay. Now, Dr. Villa, what's the prognosis for someone who undergoes treatment for prostate cancer? I know it depends on what stage or what grade the cancer is at, but in general, in terms of prostate cancer treatment, what is the outlook for someone going through this?
The outlook for prostate cancer patients is generally very good because the prostate cancer is often an indolent disease. It grows very slowly, and if it's there, then the treatment options available are very effective. So I can generally say that the outlook or the overall survival for prostate cancer, though it will depend on the stage and grade that it has been caught initially, the patients have a very good overall survival as long as they get the appropriate and timely treatment for it.
Okay. And those who are undergoing this type of treatment, Dr. Villa, ano mga dapat hindi nila gawin once nagawa na nila yung treatment? Anong mga bawal na ngayon sa kanila?
Bawal in terms of their prostate cancer, actually, lots of cancer patients ask that, not only prostate cancer patients. There's generally nothing to avoid except that what we healthy individuals avoid, they also avoid. Like, for example, sugary foods or high salt intake, so red meat consumption. So those are just the things that they avoid. But instead, they maintain a healthy weight, an active lifestyle, and consume a generally well-balanced meal.
Okay, very good advice. Now, Dr. Rome, before I let both of you go, anong parting advice that you can give our male viewers here when it comes to keeping their prostate healthy?
Okay, thank you. So first of all is to watch out for the symptoms that I said for urinary symptoms. And second of all, make sure you get screened. So I always advise my patient, kung hindi Father's Day, at least on their birthday. So get checked, not just the prostate, but generally as well. You may check for other blood parameters. So this way, they won't forget when to get checked or when to get screened for prostate cancer. And of course, a healthy lifestyle for males. So for males, so you should avoid smoking, get a hearty, regular exercise, and also avoid excessive alcoholism.
And it was a pleasure speaking to urologist Dr. Romeo Lloyd Romero and radiation oncologist Dr. Evita Pagya-Bondok. Thank you so much for joining us on the program. All men are at risk for prostate cancer, but if it's caught and treated early, the outlook is generally good. Our mission is for better health for you and your loved ones. I'm Dr. Freddy Gomez.